Alright, guys. So, good morning, guys. So, we're about to go into our other discussions on orthopedics. All right, and here the first aspect which we are going to pick up to talk about today is what infections. You know, infections go hand in hand with bone infections and bone destruction. You understand? So, infections are a very vital part of orthopedics that we always discuss. So, for discussion of infections in orthopedics, it is as follows. Okay, so let's have it. For the general aspect of infections in orthopedics, it's mainly all these infections that could actually cause a lot of bone destructions, and all of that. So they're actually a major clinical challenge when it comes to orthopedics, and infections could actually affect your bones, your joints, even implants. That's basically things that you put in the body to actually replace those bones. So it could lead to what? Prolonged treatment. Sometimes you might have treated something, you would have treated something for a short time, but it's because of the infections are coming in. That's why I have to treat for a longer time. They cause disability, and they could also even cause life-threatening issues. So the different types of infections that we deal with in orthopedics include the following. We have osteomyelitis, which is infection of the bone; septic arthritis, which is infection of the joint space. Okay, so this is infection of the joint space. This is what osteomyelitis, which is infection of the bone directly; septic arthritis, which is what infection of the joint space. Then prosthetic infections. This one now, there's infections around what that prosthetic stuff that you actually put to replace the bone that had issues. So you're now still having issues in this thing that you now put newly again. So that's what we got. We have implant or prosthetic infections, soft tissue infections like all those cellulitis, abscesses, surgical site infections. So that's what we got. So causes, it could be due to physical traumas. Okay, it could be surgeries. That's after surgery. Maybe during the surgery, everything was not actually done so neat. So the issues are coming in after the surgery. Could be due to systemic issues, that maybe the person has a particular disease condition that is predisposing them to have infection. A disease condition that could be making your immune system so weak. Could be foreign material. Could be poor vascular supply. So it could be that is the blood supply to that particular part that is kind of like compromised or something. So pathophysiology is just trying to look at different ways in which that infection can be able to get to you. So it could be direct inoculation, where the infection was directly put there, probably from surgical devices, they were not clean. It could be hematogenous spread, where the infection was from somewhere else, but it got into blood and eventually spread to that part. It could be contagious spread. It could be biofilm formation. Okay, so they can now complicate any disease condition, causing a lot of pain, swelling, redness, warmth, wound discharge. Systemic issues, functional impairment, then also sinus tract formations and all of that. So you diagnose them from all those lab tests for complete blood counts, trying to do tests to see all those inflammatory markers if they are high, blood cultures. Then you do imaging like all those X-rays, CT scans, MRI, Okay, then microbiology tests. Okay, so management principles is what antibacterials, right? So broad spectrum. You can also debride, where you now remove parts of the dead tissues. Okay, then sometimes you can remove the implants if they are causing too much issues, and to reimplant them when things are good. Then also drain the abscess. Okay, pain control, nutritional control, and management of what? Comorbidities. That's underlying disease conditions.